My name is Dr. Alan Valadie. I'm an orthopedic surgeon here at Coastal Orthopedics in Sarasota-Bradenton area. I've been in practice for 20 years and predominantly practice hip and knee replacement, adult reconstruction of the hip and knee joint. Joint replacements have been performed in the United States really since the 1960s. There's been constant evolution over the last 50 to 60 years in terms of how we perform these procedures. So decades ago, these were done in the hospital and patients would spend a couple of weeks in the hospital and then in rehab centers, and there was really a long recovery. Thankfully, with increases in technology and improvements in techniques, we've really been able to make a lot of progress, and so the recovery is much less than it used to be with these procedures. Hip and knee replacements still have a place in the hospital, but what we're finding is with improvements in how we perform these procedures and our pain management techniques, many of these patients can have the procedures performed as an outpatient. And when I say an outpatient, these are typically done nowadays in our surgery center, and patients can go home the same day. With the evolution in techniques and pain management, we have found that the recovery time gets faster and faster with these patients. So now, instead of 2 to 3 days in the hospital, which was the standard even up to 5 or 6 years ago, we have found many patients were able to leave even the next day. And then as we've gone to the next step, we have found over the last year or two that many patients really don't even need to spend any time in the hospital. So over the last 2 years, we've transitioned in healthy patients to offering this as a pure outpatient procedure. In other words, the procedure can be performed at the surgery center and the patients can be sent directly home for their recovery. What that means for the patient is that they can avoid a hospital stay of even 2 or 3 days. So instead of being in an unfamiliar setting, blood draws every day, schedules that may not be ones that you're used to, patients can have the procedure, go straight home, and recover in the comfort of their own home. For our patients who have outpatient hip and knee replacement surgery, they go straight to outpatient physical therapy. They don't need a rehab center, they don't need home therapy. We send them straight to outpatient therapy within 2 to 3 days of the operation. The joint replacements we're performing at the surgery center really are the same ones that we have traditionally done at the hospital. For me personally, hip and knee replacements, including partial knee replacements, are the ones that we're performing at the surgery center. We've also started doing shoulder replacements with some of our shoulder specialists. The appropriate candidate for an outpatient joint replacement is really somebody who is healthy, relatively younger, under the age of 65 generally, and part of that is because Medicare doesn't yet allow us to do this at the surgery center for hip and knee replacement. Partial knee replacements we can, but generally younger patients, healthier patients, and ones who have a good home environment. In other words, they have some family support at home, and the physical environment at home is amenable to that patient going directly home for their recovery. We're really having excellent results with our outpatient hip and knee replacement program. Many patients are surprised that a procedure like this can be performed as an outpatient, but they're thrilled to hear that they can actually do this, recover in the home, and avoid the hospital if possible. From a clinical standpoint, we've had excellent results. Patients go directly to outpatient physical therapy, and really we're seeing very quick rehab and recovery. It's a growing number. Insurance companies, I think, are starting to get used to this concept, and sometimes that's the limiting factor. We've been doing these procedures for over 2 years in the outpatient setting. This sets Coastal Orthopedics apart as the only group in Manatee County offering outpatient joint replacement procedures, and one of the few groups around the state offering these as well.